That's the true moonshot. It's this notion of you treat the soft stuff like the hard stuff, like not just patient experience because of a score on a survey. If we're truly going to drive better health, we have to earn trust. The way we earn trust is high reliability at every step of every patient's encounter with the organization, with the industry.
Welcome to A&M Healthcare Industry Group's What's Your Moonshot podcast series, where leaders seek to solve big problems and transform healthcare. Join us for conversations to hear how their vision and bold moonshots are becoming reality.
Welcome to A&M's What's Your Moonshot podcast series. I'm Jamie LaGuardia-Frie, Chief Commercial Officer of A&M's Health Industry Group. I'm joined by my co-host, Dr. David Shulkin, Ninth Secretary of the U.S. Department of Veterans Affairs, also a Senior Advisor at A&M. Today, we're speaking with Dr. John D'Angelo, President and CEO of Northwell Health. John, welcome. We're so happy to have you here.
Great. Thanks for having me.
Great.
Happy to be here.
So you've been in your job now a little bit.
Yeah.
And, but you're a longtime Northwell physician and leader. And so what are your hopes? What are you trying to do to accomplish for the Northwell system and the communities that you serve?
Sure. Yeah, I've been in the role since October 1st. I selected last April, so it's been a year, at least in the transition. And yeah, I've been with Northwell 25 years. I started there as an emergency physician. And like many of my Northwell colleagues, I've had 6 or 7 different careers all within the same organization. It truly is an organization that, when it recognizes talent, has plenty of opportunity for folks to invest in that talent, both formally and informal programs. And I've had, in retrospect, a growth during that time that I think prepared me for today. You know, most organizations would say greater than 10 years in one place, it's stagnation. And Northwell, it's seen as a sign of growth. But anyway, so yeah, I've been there 25 years. It's an organization that has continually evolved. It doesn't really stand still. And Michael Dowling was an incredible predecessor. And he built an incredible organization that there's such commitment around our mission and our vision, which is why so many of us have been around so long.
Yeah.
But we are also, like I said, an organization that doesn't stand still. And with the dynamics of today, the industry challenges and the incredible opportunity that we have, innovation, technology, and all sorts of things, we're going to continue to evolve. But what I've been frequently quoting to our staff and our leaders, it's an evolution, not a revolution. And, we're in a really good space, but there's so much opportunity and so much, we have such a great opportunity in front of us for further growth and impact that I'm really excited to lead.
Yeah. Well, one of the things everyone talks in general about how the healthcare system is fundamentally broken, that patients are concerned about affordability, concerned about access, the cost curves haven't been bent. You have such a large impact in the New York area. Yeah. How are you thinking about this type of evolution to be able to be more responsive to where healthcare needs to go?
Yeah, it's a big responsibility, and I don't take the weight of that lightly. We are the largest in New York, and we serve a population of over 13 million people. And for those that don't know Northwell, I have 106,000 team members that rely on me and our organization, and we take that seriously. We're also we represent a very diverse geographic footprint. We have incredible diversity of communities we serve, and small, critical access community hospitals to big quaternary facilities. Again, many different geographies around New York and Connecticut. So in my opinion, the Northwell size, scale, brand creates an incredible opportunity to lead where I believe we need to go as an industry. To your point, there's a lot of trends that we need to be very aware of. One is the affordability crisis for all stakeholders, and it's the way the system's designed. And I don't think you have to sacrifice efficiency or quality or access in the name of affordability if you do it right. If we attack that in the wrong way with a sledgehammer just trying to drive down prices, I think it could potentially have an impact on outcomes and quality. So as the provider in the discussion, the provider side of the industry, I think we need to have a stronger voice in making sure we drive affordability the right way. And then we're looking at other things that are impacting the industry, workforce shortages, aging population, an epidemic of chronic disease. So in that, I see incredible opportunity if we leverage innovation, leverage technology and things that are coming out to really change how we think about healthcare delivery. how do we bend the curve on chronic disease? We got to be much more personalized and upstream and much more proactive. Things we don't necessarily get paid for today, but it's the right thing to do. So the whole shift to driving health and wellness, and the shift from almost like a patriarchal kind of once a year interactive kind of experience when you're ill or when you're, to a more of a partnership with our patients and being someone who they feel is with them every step of their health journey and driving overall health, I think is part of the answer of driving affordability, decreasing future capacity demand on the acute care side, bending the curve on chronic disease. I think these are all things we need to be creative about. And we have to be innovative on the delivery side, which I'm excited to again, have a voice at the table, and Northwell providing us the opportunity to, again, drive that change.
So John, healthcare is something we all experience, often in the times that matter the most.
Yep.
But despite its importance, patients are, saying that the system can feel fragmented,
Absolutely.
somewhat transactional.
Yep.
So your moonshot addresses their burning question,
Yep.
which is, how do you vision transforming healthcare to improve the patient experience?
Yeah, that's the true moonshot. And it's this notion of you treat the soft stuff like the hard stuff.
Mm-hmm.
Like, it's not just patient experience because of a score on a survey. If we're truly going to drive better health, we have to earn trust. The way we earn trust is high reliability at every step of every patient's encounter with the organization, with the industry. And I think, and I read a ton of patient complaints and compliments. I've dove into the engagement surveys, both of the team members and patients, my whole career. And we, for the most part, we have an incredible healthcare system. The care we deliver to patients when they're a patient in the bed, for the most part, is exceptional. Where as an industry, we fall short a lot. And there is a distinction between when they're a patient and we're providing care, and when they're a customer, and we have to think through that consumerism lens on everything that leads up to, during, and past that interaction. And we dropped the ball quite a bit. We dropped the ball on access, on referral management, on all the things that people have come to enjoy in every other aspect of their life. And part of it's from incredible regulatory burden, administrative burden, very fragmented technology infrastructure. There's a lot of drivers of that, but the moonshot is that can't be an excuse. So again, it gets to highly reliable, personalized, proactive relationship and partnership with those we serve. That's not just transactional. And on the flip side of that, we have to get there by also recognizing that for forever, because of the financial dynamics of healthcare, we've done as an incredible job as an industry, but on the backs of our frontline staff, who we're constantly asking to do more with less, do more with less, do more with less, because our expense trends don't keep up with the revenue trends. And the answer every year trying to close gaps is how do we get more and more efficient? We are extremely efficient for the most part in a lot of these clinical arenas. So the question is, how do we work smarter, not harder, release that administrative burden, and really also become, for Northwell, my goal is to become the employer of choice in the industry. So again, we're doing everything we can that we have the most engaged, empowered workforce as well. And if those two sides of the equation, thinking about the patient and the consumer and the workforce, I think we can get to that future.
Yeah, I'm so glad you brought that up regarding cost and efficiency, because that's a theme that we hear constantly, with talking to healthcare executives across the country. My question is, if you're looking to reduce costs, improve efficiency, how are you doing this without the trade-off of the human experience?
Right. I think the trade-off, the concept of the trade-off exists because of the poor design of the system. And I refuse to accept that. So I don't think it has to be a trade-off, which is why the providers, the healthcare provider side of the industry, not the payers, not the regulatory, the political side, everybody plays a piece. But we're the folks that are the non-for-profits at the table that are working in a zero-sum game environment, who are there first and foremost to improve health. And we have not done a great job, I think, as a provider industry of really speaking with one voice and how we get to that future. So, and it's something my colleagues, other CEOs I'm now interacting with quite a bit, especially in the downstate New York area, we're talking a lot about. But I think it doesn't have to be a trade-off, but we have to do it surgically. We have to recognize that there is an affordability crisis, and we have to do everything in our power to drive down the overall cost. And if we do that in a way, again, that's going more upstream, more driving better health, therefore less acute care demand, higher expense demand, that's one vehicle. It's a long game. How do we bend the curve on chronic disease? That's going to dramatically reduce costs. You know, diabetes, hypertension, obesity, things have all doubled and tripled over the last few decades in this country. We have to tackle that, right? 80% of these outcomes are not what happens in the bedside. So there's a way forward to affordability. And then the other drive of affordability is we have to get out of our own way with care model, not protecting scope of practice and this other stuff. And how do we get much more creative, leveraging technology to amplify the capabilities of the workforce, be more innovative about the type of workforce we may need in the future. It may not even be roles we have today that help us, again, drive that more high touch experience. So I envision in a future, as an example, where 20-30% of our workforce growth may be more community-based workforce that's clinically skilled to a certain level, digitally enabled, and digitally connected to their digitally enabled patients that they're responsible for. As the frail patients are wearing smart clothing and have Bluetooth scales and blood pressure, how are we going to be more proactive in that relationship? And technology will be a great enabler of driving that better care, that less demand, and therefore better affordability. Again, if we just try to drive down prices, understanding it's a zero-sum game, we have to make tough decisions on the provider side, which ultimately will impact access and quality. And that's what I'm trying to avoid in this journey.
Right. We hear so many leaders describe the problems in healthcare the way that you have, but they often look towards the problem is external to their organization. It's the reimbursement environment, it's the regulatory environment, it's the policies that are in place that don't allow them to pay for the things that they want to do. But it seems like your approach is really internally focused, that you're saying, look, we have a responsibility to make these improvements internally. How are you planning on engaging your workforce, your physicians and your 100-something thousand employees in understanding that they have a responsibility in this chain?
Yeah, no, it's been part of my, hitting the ground running day one. It's kind of the ED doc in me, very action oriented. And, I've been making this part of, I've continued a tradition that Michael had done for years that he's very proud of, that when he kept saying to me in the transition, we're still going to do beginnings, right? I was like, Michael, that's a lot, but it's the best thing I do. And I go to orientation every week where we hire a couple hundred people a week. We're so big. But every one of them goes through what we call beginnings, and I spend an hour with them, driving the point of our responsibility and the incredible, impact we could have, and bringing them back to purpose. I think bringing people to purpose and commitment is a better way to lead than compliance. And, so driving that point, the responsibility that you're talking about with whether it's physicians or, again, any employee, it's understanding that first and foremost, we are here to make people's lives better. And that's an incredible responsibility. What they hear all the time is about finances. It's always about, the challenges, the finances, cuts here. We have to change that dialogue a little bit. I'm trying to change that dialogue where I'm reminding people we have to be financially strong to be here, to do these incredible things. But first and foremost, we're here to treat patients. And it depends on the audience. If I'm talking to doctors, I'm trying to bring them back to purpose. And I know they feel they're on an RVU treadmill and all they hear is productivity. They don't hear about purpose as much as they should. They need to know they have a physician CEO who's committed to, at a pace that's reasonable and with the constraints we have, the right thing at the right time, reducing that administrative burden, bringing the joy back into medicine, making it so that they can get through their day, keep their empathy banks high, and really feel good about themselves at the end of the day, and not sit on their computer for 2 hours afterwards trying to catch up on charts. So I realize all the tools. They just have to know they have a CEO that's been at every step of that journey and is cognizant of it and is going to do everything in my power to serve them. While at the same time, I need them to do everything in their power to understand that we came into this because of a calling, and we need to stay true to that. So it's how you motivate everybody and keep everybody aligned with that responsibility. It's been the fun part of the job. Yeah.
So as you advance your leadership journey and engaging your teams and engaging your leaders, what will fundamentally feel different for your patients as you advance this journey and these patients engage in Northwell Health?
Yeah, I think what'll fundamentally feel different, I'm hoping, is that they'll realize over time, and there's a lot of infrastructure has to go into place. This is a 3 to 5 year journey. but they'll feel that they have a true partner. And that's as simple as I can say, that we're going to transform that human experience for them. And I give the staff an example. We have so much data. We have so much great technology. Now we're going onto one platform finally, which has not been our case in our evolution of one hospital merger at a time. There's no reason why Mr. Smith doesn't get a message that says, happy birthday. I realize you just turned 50 today. We know you quit smoking 10 years ago, but you did have a 20 plus back year history. Did you know you qualify for lung cancer screening? We've already gotten pre-authorization from your insurance. And I see you live in Babylon, and the Great South Bay Imaging Center has 3 appointments next week. Can I put you into one of them? And if you don't have a ride, we have an Uber, take it. That kind of like, not just onslaught of disjointed, fragmented encounters, but that Northwell's always got my back relationship is what I'm striving for. That's going to take time, but it's all that coming together. And I think that's what people will feel when they leave the hospital and we say it's important you have these 3 follow-ups, that they're leaving with those follow-ups, or somebody's navigating them the next day. It's not, we said it's important to do this in 2 weeks and then they're told the next appointment is 6 months. That doesn't work. So these have to be never events. And when I talk to the staff, it's this concept of many entry points, but one front door, one experience that is guaranteed 100% of the time. That level of high reliability is where we need to get to again, earn that trust.
Takes the guesswork out of healthcare, right?
Yeah. It's critically important.
Yeah. John, I love that vision. And, the closest that comes to in my life is my dentist who, says, hey, it's time to see you again. And, what's going on. And so the type of personalization and information that you have and looking out for the patients that you serve is great. There also would seem to be a need to be able to respond to patients' questions.
Yep.
And when they need help, to be able to reach out to a trusted source like Northwell.
Right.
But does our reimbursement environment need to change to do that?
Yeah, in time, our reimbursement structure needs to change dramatically, in my opinion. And the more we can start to direct reimbursement that's more focused, again, on wellness, whether it's virtual interactions, all sorts of different types of interactions that ultimately drive health, should be part of the equation. But I understand also, with the affordability crisis, that's also a zero-sum game. So we have to be willing to get innovative, and maybe on some of the things that we traditionally were getting paid at the very high end for. But there's got to be a give and take there. So we need to rethink the reimbursement structure, in my mind, to drive the outcomes we're looking for. And again, it's transitioning from the current medicine of episodic disease management to, again, that more overall health kind of concept. So the payment structure has to evolve. One of the things we're doing that I think creates an opportunity for us to demonstrate how that could work is we have our own direct-to-employer insurance product, for example, which is, there's many examples of how our scale and our size, I know people have a lot of opinions about big health systems and so forth, but the scale or size allows us to do things that independents can't. And one of those things is we created Northwell Direct, which is a direct-to-employer only product for self-employed. And we now have 340,000 lives in that.
Wow.
And we just signed a deal as the primary provider for one of the largest unions in New York, has 70,000 lives of union members coming in, saving them 20% of their costs. But we're, through those types of relationships, I'm confident we're paying ourselves. We can show the value of all these other non-traditional kind of encounters or services we can provide. We can shift the cost curve around a little bit. We can show better outcomes. So I'm hoping that provides a vehicle for us to demonstrate and then make the case for others to maybe to accept. Just one example of how we think about leveraging our system, as we call it, or our size and our scale, and some of the things we've put together over the years to lead from the front and to not just talk about solutions, but deliver solutions that hopefully, if we're right and they work, others will adapt.
Yeah. Well, we very much appreciate you spending the time with us today. These are important things you're working on, and we need you to be successful, and we're going to follow your progress.
Very much appreciate the opportunity.
Thank you so much for joining us. It was so wonderful to have you here.
All right.
Great.
Good seeing you. Thanks.
Alvarez and Marcel. Leadership. Action. Results.